So the next gas we're speaking about is the second on the gas monitor, and it's oxygen, so O2 levels. And you can see at the moment that's at 21.1. It should 20.9 is the standard oxygen levels in the atmosphere. So what's the issue with oxygen in a confined space? So the alarm is set to go off at 19%, so that's the lower limit, and 23% being the higher limit. So what does a higher limit mean, and what's the effect on us as humans? So at 23% oxygen, we don't have any physiological effect on us. In actual fact, as a paramedic, if I arrive on the scene and you're having chest pain or any type of a trauma or incident, I'm going to put some type of oxygen mask on you, and I'm going to titrate the oxygen to bring your oxygen levels up. So you could often be on high flow oxygen. So it doesn't have any kind of physiological effect on us. It enriches our blood with oxygen, and it makes our heart, beat a bit easier. So what's the issue with 23% being a high alarm? It makes the atmosphere more flammable. So if you have an ignition source in that area or a fire in that area, it's going to burn brighter and it's going to burn quicker. So that's the issue. It's a flammability range when we're talking about higher ranges. The lower range, so when we hit 19% and the alarm goes off, we're in an atmosphere where the oxygen level is decreasing. So what does that mean? Well, at 19% oxygen, again, there's not a huge physiological effect on us. We may breathe a little bit quicker to compensate for maybe a small drop of oxygen in our blood levels. But when we start to hit 18 and 17%, then we physically start to breathe a bit quicker. And in an atmosphere that's already low in oxygen, that's not a good thing. When we hit kind of 15 and 14%, we start to become confused, and we start to make bad decisions about what we're trying to do because we don't have enough oxygen going to our brain. When we hit 12%, we start to become paralytic. So although you physically want to move, you can't really move and make dexterous and functional movements towards your exit point. And then when we drop below 10 and into kind of 8 and 6%, you start to go into respiratory arrest, and then you're in real trouble. Just as a matter of interest, a 1% drop in the atmosphere, so from 20.9 to 19.9 is only 1%. It doesn't set the alarm off. The alarm doesn't go off to 19%, sometimes 19.5 in some models. But it's dropped 1%, and you may think that that's okay, but that needs to be reevaluated. You need to put your monitor back into the space, because 1% of an atmosphere equals 10,000 parts per million. And when we speak about the next two gases in the next couple of days, when we're talking about H2S and CO2, or carbon monoxide, CO, 10,000 parts per million is absolutely fatal. And any gas that the monitor doesn't pick up at 10,000 parts per million can be fatal. So if you get anything that's not reading 20.9% oxygen, you need to reevaluate until you get them numbers right again. Okay, thank you.